Lisa, Helen,
Hi.
hello.
Hello.
Hi.
It's good to see you again, Helen. We've had a video already. Lisa, it's the first time for you to join us, and it's great that you can.
Oh, well, thank you for having me.
Well, it's my pleasure. And it's great to have two GPs at once. That's pretty awesome. That's pretty
We're like
awesome.
bosses.
Well, yeah, I guess so. Um, I mean, you've both got similar sort of experiences to get you where you are with that particular interest in allergies, and I'd be quite happy to describe you both as allergy experts, and the contacts that you have, not just with patients with allergies and people with allergies. And Helen, you've got that amazing Facebook group as well to be able to connect. It's your own personal experience that is super valuable in addition to the kind of professional knowledge that you have and that wider contact. And you've both got a, different angles, so children and adults. So it's a great mix, and I'm very grateful for you both joining us on this call. We're gonna really talk about that kind of experience that somebody might have, that they go to a GP or they have that suspicion that they've got an allergy or a child has got an allergy. We'll kind of leave it open, but similar to that, I think. Um, and your experience through your contacts, what's going on out there. And we have certainly calls coming through to our helpline of people's initial contact with their GP. But what sort of thing what would somebody go into a GP and expect really to come out with? Do they immediately go in, they have a full-on consultation with that GP's as knowledgeable as you about allergies, and they come out with a whole thing that then transforms their lives thereafter? What's the reality? Lisa, let me ask you
What's
first.
that?
So I guess it depends if you're talking about a child or an adult. But for instance, with me, I maybe deal a bit more with adults, and Helen more so with children. But we both do crossover. But within we first of all, we only get 10 minutes for the initial consultation in general practice, so that's where it differs quite a lot from secondary care and hospital. And I guess as GPs, the main thing we're trying to do is get across what the patient is most worried about, or what their main problem is in that 10 minutes. So they might have a lot of questions or lots of queries about allergy, but we're trying to get across what they're mainly worried about, and what, if we can help them with that one thing, what can that be? And their experience in allergy may vary depending on who they see. I guess that's quite important to say. It might not necessarily be a doctor, it could be a nurse or a paramedic, a pharmacist in some surgeries. But the key really for us is taking a really good history from the patient. And if we can get that history out from them initially, that will really help us see what we need to do for them initially, and then in follow up.
So Helen, with that kind of in mind, and looking at somebody's history, should a patient go into the surgery and think, right, okay, I've done a food diary, I've noted down already my kind of trigger points, or really going in and then you discussing that in a consultation is a better way of doing it?
I think it varies from person to person and what the problem is, whether they're talking about immediate reactions, which are the IgE reactions, or the non-IgE reactions, which are sort of often quite gut-heavy symptoms. Some people will come quite well read up and probably in many cases steer the conversation. And that's fine to, it can be quite helpful if they've already brought in the information. But if actually they've done food diaries ahead of time, it could be quite helpful if they submit to the surgery before they actually then have their appointment, so that the GP or whoever they're actually seeing has an opportunity to read it ahead of time. And the other good thing is if that particular person they were seeing was perhaps not quite so clued up about allergy, they could perhaps then do some reading to be ready. Because the reality is, as GPs, we cannot possibly know everything. And I'm an expert in allergy, but maybe not so much in hips. So sometimes if I know I've got someone coming about hips, I might well do a bit of reading before I see them. So, it often depends on what the problem is. If it's very obvious that it's sort of IgE reactions, you may well know that you're going to refer them at the end or arrange some allergy testing, perhaps. For children, we tend to probably jump to referring perhaps sooner than adults, where we might arrange a blood test, because it's often a bit more acceptable to have adults having blood tests than children. So I'm happy to be led either way, but if you've got information ahead of time, it would be really useful to have it before the appointment.
before the appointment.
Yeah.
And I mean, again, it's, all of these sorts of things are quite general, and it depends on the practice and all the rest of it. But would you expect as an adult, let's start with as an adult patient now, would you see have a consultation with a GP and then almost leave that consultation with a prescription for maybe the auto injectors, maybe a referral on, or do you think it takes a bit of time really to build up an understanding over 2 or 3 consultations?
Yeah, I mean, I think I agree with Helen. It's quite difficult in 10 minutes to get that diagnosis at the end of it. And I think what we're looking at in that 10 minutes is really trying to get as much information as we can across. So getting a really good history, a focus allergy history, and being able to work with that. So we might well from there organise some testing in primary care. We can do that, and mainly it would be specific IgE blood tests that we've got available to us. And that will obviously help them with the diagnosis. And in some cases, like Helen said, if it's a clear cut, if a patient's had an anaphylactic reaction to a food, then it would be important in that 10 minutes to actually prescribe an adrenaline autoinjector, because obviously that changes, the importance of that consultation. And you would follow them up and give them the other information further down the line, but actually trying to do what's important in that first 10 minutes can sometimes be quite tricky. And as much information we get from the patients, and they can, as Helen said, they can send that in beforehand. Within our practice, we would kind of steer that. So we've got myself and another GP that specialise in allergy. So those kind of e-consults that come through, where patients have put that information through, they might come to me because I have an interest in it. So it's helpful if they give us that information, because we can make sure they see the right person.
That's handy. And similarly then with children, parents taking their child in a couple of consultations rather than expecting it again on that first contact to go away and have everything.
Yeah, I think it does, if you see me, I probably try and do everything straight at once because I know what needs doing. But it is quite reasonable that we do things over time. And if you look at the evidence of how much information anyone takes in after any sort of appointment, I think it's something like 10%. So there may be better worth by the fact that they might come in and get the diagnosis, and then we say, rebook with us. I mean, this is in the brilliant world of having availability of appointments, of course, but rebook with us so that we can actually talk to you about food labeling. Or perhaps the GPs might not know that, but they would know that they could send you to other places for support. So we text out links quite a lot. So I text out links like Anaphylaxis UK's website for links. I'll text out weaning advice from the British Society of Allergy and Clinical Immunology. So there's good generalized website called patient.info. You can get, so we text out all sorts of things to support what we've said, because 10 minutes to try and take a full history, then give you all the diagnosis and all the accompanying information is unrealistic. And it's probably better that we recognize that and say, we're going to need to rebook you to talk about this further. And generally, within the space of waiting a week or two, that's quite safe, given that you're actually more likely to wait nearly a year for your allergy appointment.
So while somebody is waiting for that referral onto an allergy clinic, knowing how long, many places, how long their waiting times are, and the anxiety and the worry that's caused really by that wait, what are the sorts of things that you as a GP might advise a patient while they're waiting to do? What would they do, either in activities or change of behaviour, or indeed, what support could they get while they're waiting?
Yeah, so
Go first.
Yeah, sure. Well, we would obviously signpost them to resources, and like Helen said, we would obviously not just refer them and leave them with that anxiety of, we would put them in to see us again, make sure that they've taken on board, what we've told them. They may have questions later down the line they've not thought to ask us initially that have now become important. Now they do some reading. And also we know that our patients with allergy, they don't present with one type of problem. They often have eczema, asthma, hay fever, and our job in primary care is to look at the whole patient, so pick up on those things and actually see where we can improve their care. We've got access to psychological support, so we can refer them if they are anxious and they've got health anxiety. We can utilise that and we can get the right people to help them with that. So there's a lot that we can do actually, and a lot that we should be able to do before the patient even, you know, gets their secondary care appointment.
Helen, would you say that anxiety is one of the big things? It's one of the main causes of concern for a parent when they, you know, when they've got that kind of confirmation that the child has got you know, an allergy, particularly the serious allergies that you know, that they are then waiting a fair amount of time in a state of worry.
Yeah, they can be, children and adults, you know, because if you're being told something could be potentially life-threatening, if you don't, and I guess I'd encourage my colleagues to go, even if you don't know loads about allergy or don't feel that you do, what we are really good at is being holistic and supporting people through that worry and giving tips that are sensible about, you know, how do you read packets and just keep that child or adult safe, really. But worry is a big thing. And so one of the main things I've been making sure they know is how to keep themselves safe, how to recognize allergic reactions, and make sure they have whatever medication they need, antihistamines, or if they've had anaphylaxis or they have asthma and IgE allergies, that would be indications for having adrenaline autoinjectors prescribed at the offset, and I would give it in those circumstances. And then a big factor where I see the anxiety building is around weaning, and people get given sort of two bits of advice. They either get told just don't wean until you get seen, which could be months, and that, you know, is very unrealistic and not ideal, or they get told don't worry about it, just keep going. And a sort of happy medium of acknowledging how hard that is, you know, and they might need a bit of hand holding, and the health visitors are great to do that. I've heard of health visitors recognizing the anxiety that families have around introducing peanuts, for instance, and offering to go around and be there when they do that. So whilst they're also really busy, they're a great valuable resource to families that they can give that ongoing care to. And we are good at managing anxiety in primary care, and families should use us for that support.
That's great advice. That's great advice. And then you're saying about the auto injectors, the EpiPens, the Jex, the Emerades. Now you won't be giving the pens over to the patient. You'll be giving the prescription. What many people find somewhat challenging, because it's it's new, is how to use them. Now we've got videos coming out and some support on our website on how to use the different pens. But would you say that, you know, patients would ask you how to use them as well as a GP? Now you'll know how, but you know, again, with that G part of the GP being general, you know, GPs sometimes as well may not be as freshly trained and familiar with how they work. But pharmacists, of course, they may be also, because that's where you are actually getting. Would you say that, you know?
Yeah, I mean, I think within our practice, we've got kind of a kit that we've got all the training pens, you know, all different brands, and GPs, pharmacists, nurses, we can all access that and demonstrate to the patients the different types of pens. You know, there might be some GPs that don't feel confident to do that, and that's fine. Not everybody needs to know that, but there needs to be at least 2 or 3 people in the practice that are confident and that can do, you know, can show the patients how to use that and let them have a go and decide what pen will work for best with them, really, you know, and that's really important. And I think most practices do have a designated person, whether it's a practice nurse or a pharmacist or a GP with an interest in allergy, that can do that. Obviously, we've got the resources, the videos online, which are really helpful. But I think in most practices, I would say that patients should feel confident that there would be someone that they can, you know, have a consultation with that should show them how to do that.
Yeah, I think it's sometimes overlooked. It's surprising to me how many people are given auto injectors and perhaps don't even ask, how do I use them, as an assumption. And I know when I had with Ethan, who had allergies, was given it by the consultant, he did say, do you know how to use this? And I said, yeah. And he said, demonstrate then. And I would have stabbed myself. So we also have to take it on ourselves that if we're prescribing, we wouldn't prescribe insulin injections, for instance, without demonstrating and showing. And we have to get that across to all our colleagues that we can prescribe it and say, we're going to book you in with whoever is skilled at training you. And they also can access all the training videos, not just on our charity site, but on, you know, the manufacturer's website. but we need to realise patients won't ask us how to use them. It is our responsibility when we are prescribing them. And even if we're carrying on that prescription from secondary care, we must make sure we train every time.
And of course, there's the importance of carrying two, having two,
Yeah.
and you know, I'm wondering sometimes how much emphasis there is upon, you know, you must carry two. I mean, it is very difficult to, particularly with teenagers, to think, well, actually, you're going to carry these two bulky bits of kit around with you, you know, at all times. But it is very important, of course, to carry the two.
It is, and it's a good opportunity every time we see them to say, oh, that's what we do in allergy clinics. Can I see your pens? Because you often
Right.
catch that. Interestingly, my husband helps me at the shows, and we were at the Allergy Free From show, and this lady was talking to us from another stand, telling us she was anaphylactic to fish. I wasn't there, and he said, "Oh, have you got your pens with you?" And she said, "Yes." And he said, "Where are they?" And she said, "Well, they're only in my bag, right over the other side of the hall." And actually, she was in a food environment, so you have to literally carry them everywhere because you shouldn't be moving when you have anaphylaxis. And even that delay is not something we ideally want. So it's not trying to catch people out, it's just trying to, you know, emphasize we should take them everywhere. They're life-saving.
I think one of the things that we do in general practice is when we see patients for any problem, if I know that myself and my colleagues at my practice do this, well, if we see they've been prescribed a pen, we will absolutely say that, oh, you know, you've got 2 pens, can I see them? Can you show them to me? And I would say 9 times out of 10, they're out of date, unfortunately. And, you know, they're not aware that they're out of date. So we try and use an opportunistic time if they're in the practice to have a look at the pens if we can.
That's great. That's great. So finally, as GPs, what would you say are the kind of, what's really helpful, would be helpful for you as a GP? The food diary and information beforehand, maybe is the main thing to know. But what would be really super helpful to know, that a patient can prepare themselves when they have that initial consultation with you?
I think not everybody needs a food diary. Like, for instance, if it's a very barn door, I eat egg, and every time I eat egg, I swell up and I get hives. You don't need to keep a diary about everything else. But if you've got some symptoms that you just can't figure out what's going on, then it can be useful to keep a diary of what foods you're eating that day, what are the symptoms you're looking at, and hand that in ahead. We also love photos, and with the advent of, you know, phones that take photos, a really time-saving tip would be put them in a separate folder on your phone so that you can quickly access them in an appointment to show us. We will, you know, we won't cut out appointments at the end of 10 minutes, will we, Lisa? But we are trying to make that 10 minutes or 15 minutes as valuable as it can be. So help us by trying to sort of be concise. I'm not good at that. And get all your information ready, and tell us what you want, because we want to know what your agenda is too, and then we can address all of that.
Lisa, from your perspective, anything further to add to that?
Yeah, I mean, having, you know, just getting across what's important to you, because obviously giving us the history is really important to us, but we need to understand what you're worried about allergy, because actually sometimes what patients worry about and what we worry about can be very different.
Yeah.
And our job is to really help them, you know, get them on board and help them have confidence that we can actually help them with their allergies. We're perfectly placed, we're in the community, we're accessible, they can see us again. If they have queries, they can email us, they can, you know, they can contact us. So, you know, we should be able to help them with the allergies. It's not something that we just refer on. We're there to help them, and that would be the key message, really.
Right. Lisa, Helen, thank you ever so much. That's been super helpful and very informative. Let's do another video again, and you know, very much welcome anybody viewing this to leave their comments or questions or even the suggestions on the sort of topics that we can cover in this series. So thanks again, and I'll see you soon.